Time, they say, is a healer. But the last 1 year of battling COVID-19 in Nigeria has hardly healed the emotional pain and agony, as well as the economic losses suffered by many citizens as a result of the pandemic. Nigeria recorded the index case of the virus on February 27, 2020. An Italian had imported it into the country, and in a matter of days, it spread to 14 states, with Lagos, Ogun, and the Federal Capital Territory being hit hardest.
118,000 cases.
By March 2020, the World Health Organization declared the outbreak a pandemic, making countries to scale up their response mechanism. The Nigeria government set up the Presidential Task Force to coordinate a national response to the pandemic. Lockdowns were imposed in major cities, including Lagos, Ogun, and Abuja, as cases continued to rise, with many health workers getting infected and some paying the ultimate price. Dr. Tairu Yunusa is one of the frontline workers and the team lead of the Gwagwalada Isolation Center in Abuja. He provides an assessment of the way the pandemic has been managed in the last 1 year.
It is true that we didn't have what is called the doomsday prediction, as it is that dead bodies will be on the street in Africa. I know this because of our healthcare, systems and health facilities, the weaknesses. But we didn't have that. And we didn't have that. A lot of folks, a lot of people have actually done a lot of great work to make sure that we didn't have that doomsday prediction. So 1 year down the line, we say that, wow, a lot has actually gone. A lot of suffering has taken place, a lot of enjoyment has taken place. And I always know that sometimes when we sit down in the treatment center with colleagues now, and then all of us will say, wow, how did we survive this?
Apart from its disruption of livelihoods, the pandemic has also impacted negatively on responses to other killer diseases such as tuberculosis and HIV and AIDS.
Nigeria's response in the fight against TB suffered a decline due to COVID-19, and a new strategy is needed to ramp up performance.
Compared with other African countries, Nigeria has relatively kept infections and fatalities low. It also has a far lesser number of samples collected and tested. With a case fatality rate of 1.2% and recovery rate of 85.5%, Nigeria has proved naysayers wrong, who predicted massive fatality rate for the country. But if you think the country is currently out of the woods, you may have to think again. Nigeria currently has over 20,000 active cases in the treatment centers. It has recorded over 155,000 cases and 1,902 fatalities since the last 1 year. This underscores the reason why the government is intensifying efforts to secure vaccines, but it's not certain yet when the country will get its first shipment of these life-saving preparations.
As of today, purchase orders have been raised by UNICEF Supply Division for the AstraZeneca vaccine. Under normal circumstances, with routine immunization vaccines, it takes 2 weeks from when the purchase order is raised to when we receive the vaccine in Nigeria. As soon as we receive confirmation on the date of arrival, we will also inform Nigerians.
1 year on and still counting, the coronavirus is still much around, and the way it continues to impact lives and livelihoods may hardly be forgotten, even with the passage of time.